Foot pain really sucks. It can really put a damper in your day, making it difficult or even impossible to walk, or make it so you're walking on eggshells all day. Not a way you want to enjoy your day, especially now that spring is here. Maybe we'll get rid of that. A lot of people think foot pain is just foot pain, but that's not the case. There are many possible causes of foot pain, and the good news is that as a chiropractor, we can oftentimes help many of these problems. 6 most common problems we see in the office include the following. First is plantar fasciitis. If you're having heel pain, especially first step in the morning, oftentimes this is due to plantar fasciitis, or more commonly plantar fasciitis. Actually wrote a book on this or wrote a resource on this topic. If you're interested, reach out and we'll send that to you. If you're feeling sharp pain in your heel or an ache in your heel, that may be due to plantar fasciitis. Bunions. What are bunions? This has to do when your big toe starts to bend to the side, pointing outwards, like a big lump on the inside of your big toe. This is essentially due to overload and overstress of that toe joint, and the body lays down more tissue, more bone in that area, creating a bunion, and they can be extremely painful. So a lot of things we can do to try to offload those joints so they become less painful and reduce the likelihood of these bunions from progressing. Achilles tendonitis or Achilles. This is where you're going to be experiencing pain in the back of your heel or in the back of the Achilles there. This could be insertional or non-insertional, depending on where the Achilles is bothered. There's a lot of things that we can do to help alleviate pain and discomfort of the Achilles, and it can be extremely painful. I've had this problem before. It can cause a sharp pain or pain, make it impossible to walk, never mind run or do any of the activities that you love to do. Do you have fallen arches or flat feet? This is extremely common the older we get, or we also call this tibial tendon dysfunction. A couple different phases of this. Essentially, the tendon that gives the arch support of your foot starts to stretch out over time, and this can cause not only pain, but it can permanently disform your foot, causing pain to persist as time goes on. So it's extremely important to address these problems before it becomes to this late stage of this tibial issue. The pain pattern for this is typically going to be the arch of your foot, but you may also feel it up and through their shin or in your tibia. It feels like a shin splint almost. And this is more common the older we get. Are you noticing that your shoes are getting tighter or you need bigger shoes? That's likely because your arch is falling. And if this is the case, you need to get this addressed as soon as possible. Morton's neuroma is another common cause of foot pain. This is where there's a bundle of nerve that's being squished in your foot and it's causing numbness, tingling, even pain in through your foot, through essentially your toe bones. Sometimes this will feel like you're stepping on a marble. It can be extremely painful and be very difficult to walk around. One of the common causes of this is if you're wearing inappropriate footwear or too tight of shoes. So if you're doing that, it's very common to cause this Morton's neuroma, or there's different types of neuromas depending on the position. Last but not least, stress fractures are also extremely common cause of foot pain, especially in people that are very active, runners, people training for marathons or triathletes. Extremely common to cause these repetitive stress fractures in the foot. The biggest thing we can do for these is make sure that the foot biomechanics are appropriate and good, and we need to rest the foot. Allow that fracture to heal. It takes several weeks, can be extremely frustrating for these athletes, but it does need to happen, or else this pain will persist, will cause further problems down the road, and it's just going to be a nightmare. So make sure that you're treating these problems appropriately. Depending on your problem is going to guide the treatment. First and foremost, we need to make sure the biomechanics of your foot are appropriate, whether we need to do joint manipulation, mobilization, or we need to get you an orthotic, depending on what your foot biomechanics are and what your actual problem is. Another thing we need to do is alleviate the muscular tension and stress through the lower limb, through the calf, through the inside of the foot, outside of the foot, the arch. All these different structures need to be moving appropriately to offload these painful structures. There's typically going to be some type of exercises or stretches that I have my patients do that are dealing with these kind of problems, so we can alleviate the tension at home and help speed up that recovery process. You can also do various other therapies in office here. We do shockwave therapy, which is fantastic for persistent pain. Acupuncture, IMS can be extremely helpful as well, along with a rehabilitative exercise to build up strength, capacity, and endurance in those tissues that may be lacking and needing that. At the end of the day, foot pain really sucks, and if you're experiencing foot pain that's lasting more than just a couple of weeks, or it's not getting better, or it's just continuing on and getting worse, you certainly need to get that evaluated, and a chiropractor may be the right choice for you. Look forward to seeing you soon so we can help you with your foot pain.